Workers at a low-country abortion clinic have stepped forward to tell me horror stories about what they say is happening inside an abortion doctor's clinic.
Many of you have called concerned about the subject of this report, so we want to warn you that some of what you will hear may be upsetting.
Now, you will not see any graphic pictures, only hear disturbing descriptions. But nonetheless, you may want your children to leave the room.
Tonight, Dan begins a special I-team investigation into the ladies' clinic and Dr. Jesse Floyd.
Dr. Floyd operates an abortion clinic on Rivers Avenue in North Charleston. I want to make it very clear that this is not a story about the issue of abortion, pro or con. This is a story about shocking allegations made by former employees of Dr. Jesse Floyd.
You'll need it! Your cause has been defeated! Pray! You'll need it! Your cause has been defeated!
It is an issue with no middle ground. Around the country, abortion is under attack. And not just outside the clinics that do the procedure, but on your television sets.
This is not an issue of rights. This is not a social issue. This is a dead baby.
For all sorts of reasons, women turn to the ladies' clinic in North Charleston to end their pregnancies. You'd never know the ladies' clinic on Rivers Avenue was a medical building. There's only a small sign, and it is sandwiched between a pawn shop and an adult bookstore. The clinic is operated by Dr. Jesse Floyd, a Columbia-based gynecologist. Every Wednesday and Friday afternoon, he drives to Charleston to operate his clinic and to perform abortions.
One girl was in there 10 times. That was her 11th one the last time I was there.
Lori Saunders says she worked for Dr. Floyd for about a year. She says she started as a lab technician, but ended up working in the termination rooms, where the abortions are done. It was back in those two termination rooms that Lori says she saw things that disturbed her.
Tell me about the way the fetuses were disposed of after the abortion.
They put it in a colander, just like you'd strain your rice and swish it around and then put it down at disposal and turn the disposal on.
Lori says the disposal was not any sort of special equipment, but an ordinary garbage disposal like you have in your home.
It wasn't as bad when it was just like tissues and stuff, but when it got to be bones and stuff, and it was like, that's what really turned me against it.
Describe what you'd see.
Seen a leg, it was about as big as my pinky with a little tiny foot on the end of it, and that kind of like really did it for me. That was it. I couldn't take any more after that.
Lori says shortly after that, she quit working at the ladies' clinic.
Just so people understand, this is not something you heard happen.
No, it's something I saw, something I did myself.
Celeste Danish says she quit her job at the ladies' clinic this summer after only working there for a month.
Tell me what you would do after the abortion.
Hand the doctor the jug with what was taken out of the female. He'd dump it in a strainer, he'd look, and then he'd dump it in a garbage disposal, and then he'd leave the room, and I'd turn the garbage disposal on and rinse out the jugs and everything.
Celeste says one day while working at the ladies' clinic, she saw something that was the last straw. She says she was flushing an aborted fetus down the disposal when she recognized what was a fetus's leg. That was the day she quit. Celeste says she used to work at an abortion clinic in Massachusetts.
They did not put the fetal tissue down the garbage disposal in Massachusetts.
No, not at all. Nothing went down the garbage disposal, especially anything contaminated with blood or body fluids.
We wanted to ask Dr. Floyd about some of the allegations being made about how he runs his abortion clinic. He didn't want to talk to us. Dr. Floyd, I'm with Channel 2 here in Charleston. I wonder if I could ask you a question or two.
Oh.
Why do you dispose of fetuses in the sinks? I'd just like to ask you a couple of questions. Well, I want you to answer the questions. I just have a couple of questions to ask you. I'd just like to know why you dispose of fetuses in the sink. Is that according to DHEC regulations? In his years as an abortion doctor, he has seen a lot of controversy. In the early 70s, Dr. Floyd was accused of raping a student nurse in a Columbia hospital. The charges were later dropped. In 1975, Dr. Floyd was indicted on charges of murder and performing an illegal abortion for aborting a third trimester fetus. The fetus lived for 3 weeks after the operation. Those charges were also dropped. And Dr. Floyd is now involved in a lawsuit with the family of a 14-year-old girl. The suit alleges that Dr. Floyd performed an abortion on the teenager without her parents' knowledge. I tried twice to give Dr. Floyd an opportunity to respond. He declined.
Hey, get off the damn property, you son of a bitch. Stand right here and let's talk a little bit.
Okay,
when the police are here, you're going to have your ass arrested, you son of a bitch.
I'm not insulting you. Why are you insulting me?
You ought to get off the property when you're asked.
You just told me to stand here.
I told you to get off this property.
You do not want to answer any questions about
I
this.
said get off this property.
Thank you for your time. Dr. Floyd wouldn't answer any of my questions about the allegations being made about his clinic, but he may have to answer to the Department of Health and Environmental Control. DHEC has started an investigation.
We'd like to know details about the information you have so we can pursue whether there is compliance with the infectious waste regulations.
Your reaction to the idea that fetal material is just being flushed down a disposal like you'd have in your kitchen?
And I guess I'm horrified about it. It's just hard to swallow that our law allows that. And if it does allow that, it needs clearing up.
The new State Infectious Waste Management Act defines infectious waste, among other things, as blood and blood products, tissues and organs, and various body fluids.
Fetal tissue would be looked on as the products of conception, and I would assume it would be a type of body tissue.
The law says infectious medical waste must be packaged, labeled, and either buried or incinerated. There is an exclusion in the law for so-called small waste generators, which may apply to the ladies' clinic. That law was designed to help doctors and dentists to generate small amounts of medical waste every day, chuck pads and gauze and that sort of thing. But that law was never designed to allow someone to dispose of fetal material in a sink.
I don't think that anybody has ever imagined that it would allow fetuses to be just flushed down a drain, so to speak, or chopped up in a drain. I mean, that's it's shocking. The whole thing is really horrifying.
Senator McConnell told me that if the law allows an aborted fetus to be put down a garbage disposal, it shouldn't. And as a direct result of our I-Team investigation, Senator McConnell says he plans to introduce legislation to require first-term abortion clinics to be certified by the Department of Health and Environmental Control. As far as DHEC is concerned, officials tell me they will rework the regulations to forbid aborted fetuses from being put into the public sewer system.